Thank you all for your comments. I think the common message that's come out of the afternoon's discussions is that there isn't one single silver bullet that's going to make things better. But there are a number of themes that we've drawn out through the discussions today. The first is that I think the public want and expect managers not only to do the right things, they want them to behave ethically. And we heard about some of the examples in Maxine's Trust about how they're helping managers and their teams to think about, is this care right for my mum or my dad? Would I be proud to have them treated here? Second point, we heard about the role of trust boards in setting culture. They get the performance that they ask for. So if your board is putting safety and quality at the heart of what it's asking for, then that culture will percolate down through the organisation. We similarly heard about the important relationship between chief execs and chair in reinforcing those that message. So it's their behaviour and the questions that they ask have just as important role in setting the right tone and requirements. We talked about whether there should be, quite at length this afternoon, about whether there should be greater consistency in the qualities and competencies required of NHS managers, and I think the feeling was that there should be, particularly given that doctors are now setting out the standards and competencies required of medical managers. It looks a bit weird if professional managers don't have something equivalent. And we've had different views, though, about what would be the right methods for achieving that, ranging from a code of conduct, a licence to practice, fit and proper assessment for board directors, and we've heard international examples too. I think the sense we've got is that there's not great confidence that formal regulation of management is a good idea, and we've heard that even from regulatory bodies you'd think would be pro-regulation, not just people from a management background. We've heard a lot too about quality and safety in patient care, that it's not just about manager, you have to look at the teams and their contribution. And again, picking up Maxine's point, if you want to be looking at quality and safety performance, you can't wait till the indicators tell you that there's a problem. You have to start with the relationships and what people are saying in terms of the way that they are working. So listening to those whispers and putting in place support to help people when things go wrong. And we've also heard our final point today, a lot about leadership and management development. What we've got in the NHS is pretty good. Competition, we've heard, has made a difference, but what it's needed is a little bit more consistency in requirements that people are trained and developed to perform in their roles effectively, and that there's clarity about what is expected of them in the jobs that they're being asked to perform. So those are just some of the themes, I think, that we've heard today.
Just a final observation, I think, is this. I've been immensely helped by what I've heard in this room today. If I have a comment on what's been said, and this isn't a criticism of any individual contribution, it is that perhaps one thing that isn't reflected enough, and it's perhaps not surprising it's not reflected, is the sheer anger that the members of the public feel about the things that have gone wrong, not only in Stafford, but elsewhere. And a feeling that something needs to be done. Now that's inarticulate, but it is undoubtedly one of the reasons this inquiry has been set up. Public inquiries, expensive and ponderous as they are not set up because at the whim of a minister. They are only set up when there seems to be no alternative. And there's been no alternative, it is felt here, because of the public anger. And I've had the advantage, which many of you have not had, of having sat firstly through the first more private inquiry, when I had to sit listening for 3 solid weeks to 3 sets of patients, unhappily usually deceased patients' families, every day, telling me about their experiences in graphic detail. And then a repeat of that at the beginning of the current inquiry, together with affected members of the public sitting there day in, day out. And if one message I would like to give even at this early stage, it is, and I'm sure it is in many people's minds, that feeling of anger needs to be felt by every manager and every member of staff within the healthcare sector. Because unless that is there, I feel it's very easy for us all to lapse back into, frankly, the jargon that is sometimes used, particularly in policy documents. And the purpose of why the NHS is there begins to get lost again. But I've been immensely helped by what I've heard today. You can imagine that the task I have is quite a lonely one. I elected to sit without a committee. But that does have advantages. It means my view will prevail without the benefit of any management or leadership skills. So that at least is an advantage. But it is extremely helpful that people, busy people like yourselves, have given up time to come and help me. And I'm particularly grateful, of course, to our speakers, who I'm sure you'll all agree gave us a splendid introduction to today. But thank you very much for your help.